Hello and welcome to Choose a Fi. Today on the show, we have a really interesting episode. This is another one of our mailbag episodes, and it's focused on an issue that I think we haven't spent a lot of time talking about, largely because it's very complex and honestly, it's a little bit scary. It's dealing with elderly parents and their finances and all the complications that can arise from that, whether it's long term care, assisted living, them potentially running out of money, and how that could impact your own Fi journey. Plus, another question of how do I plan for long term care in my own Fi journey? I think this is going to be really, really interesting. And to help me on this, I have a true expert. I have Danielle Miura here to join me, and she is a CFP and the founder of the financial planning firm Spark Financials. And when I set up this mailbag, I actually had asked our good friend Cody Garrett to look over the questions. And he said, Danielle is the perfect person to help with this because she has her own experience as a family caregiver and she focuses on this in her financial planning firm. So, absolutely perfect. I think this is going to be really useful. With that, welcome to Choose FI. Danielle, thank you for being here. Thank you for joining me. This is really an important conversation, and it sounds like you are the absolute perfect person to have this with.
I'm so excited to be here, and I'm so thankful that you're highlighting such an important key topic that doesn't get discussed as much as it should be.
Yeah, it doesn't. And I mean, obviously, I can take a lot of that blame. I don't know if it's that it's just scary. It's one of those things like almost like healthcare in the sense that, like, the answer is so bad, you almost would rather not face it, which is frankly like a pretty terrible way to go through life. Like, we need to face these things head on and we just need to understand the reality of, okay, this is complex and it's expensive, but having some certainty reduces stress. It doesn't increase the stress, right?
It's like the 3 Ds, like death, dying, and divorce. Or if only we could switch long-term care to a D word, then we could fit it in there.
The fourth D. The fourth
Yeah.
D. Oh man. And yeah, before we hit record, you had some just absolute gems that I want you to touch on here. So you talked about maybe some of the issues being who's left to pick up the pieces if family members run out of money and potential roadblocks. And before we get into the actual mailbag questions, I was hoping if you could just give us an overview of why is this so fraught with peril and why is it so important that we start talking about it now?
I think that when we think about our financially independent journey, we're thinking about retirement or maybe accomplishing our passions so that we don't have to work the 9 to 5 anymore. And that's the beauty of being financially independent. But we're often not thinking about some of the roadblocks that may come in the way of that or may limit us from opportunities when we're financially independent. It's not like being financially independent is just us anymore. Unless you decide to totally exclude your family out of the equation and just say you're on your own, which is very unlikely for many people, your parents might be included in that financially independent journey.
Yeah, that's interesting. That's right. I don't suspect many people are that heartless, certainly that they're just going to say, oh, fend for yourself. But I also assume there is some limit as to how much, it's almost like hey, when you're planning for your own kids in terms of do you cover 401k contributions or 529 contributions first, almost to a person, financial experts say you have to take care of yourself first. So there is some balancing act here, right?
Yeah, I love the example you gave. It's like sometimes we tell clients instead of putting money into a 529 account, you need to make sure that you're okay. It's like putting the emergency mask on yourself in the airplane before you're putting it on other people. So the same goes for taking care of aging parents, or it may not even be an aging parent. It may be you become pregnant and you give birth to a lovely child, but unfortunately that child has disabilities. And that's the scary thing about caregiving is that it's not just aging parents anymore. There's such a wide variety of different caregiving. And being able to prepare for those types of moments is crucial because it's not just you anymore. It's more than just you.
Yeah, and I know you have personal experience as a family caregiver, and part of your platform now is to advocate and educate others who are either on this journey or are imminently on it. I'd love to hear how that experience has shaped you and your own financial independence journey.
hmm So I'm really grateful. My husband and I are financially independent. We are both only children. So we kind of expected caregiving to occur sometime within the time frame. We just
Right.
didn't wish it to be this early. Nothing against my family, but I didn't think at 25 that I would be a family caregiver. And so that kind of, in a way, put a little bit of a wrench into our, being financially independent, because we had to kind of adjust our timeline and change kind of our expectations about what FI meant to us. The priority that we put was my family at that time and taking care of my family. And so we had to adjust some of our expenses to meet that during that time frame. About a third of family caregivers dip into their savings to care for their aging loved ones. So this isn't something that is uncommon for caregivers to do. And usually, on average, according to the AARP study, family caregivers are spending about $7,200 per year to take care of their loved ones.
Wow.
So, if we can just go on averages, you may be pulling some of your money per year to take care of your aging loved one. And then it goes back to, are you going to leave them to, fend for themselves? Or are you going to take care of them? And that's a difficult decision to make. And that's why financial boundaries are so important, where you know that you're only willing to give up a certain amount. You are only willing to contribute to the pie this certain amount. Maybe you have other siblings who can contribute. Maybe you have other resources for them to care for themselves. But at the end of the day, there needs to be some type of a line drawn on what is your life? How are you taking care of yourself?
Yeah, that is an incredibly interesting term, financial boundaries. I think I would love to come back to that. And I think while this isn't explicit in the first question, I think that topic of financial boundaries probably will come up again as you answer this. So why don't I read Cheryl's question and we'll kind of just jump off from there. So Cheryl asked, would you have any suggestions around dealing with elderly parents who may not have made the best retirement plans? I've been extremely stressed about my parents' situation. They are in their early 80s, and I'm worried that they will run out of money. They have little understanding of finances, and my father has dementia. Their expenses are $100,000 a year. They have about $250,000 all in individual stocks, and they just ran out of cash. They have no mortgage on a home that's worth about $500,000. How should I advise them to move forward besides trying to get them to reduce expenses? Should we move part or all of their stocks to cash, index funds? Should we use the stocks first, then get a reverse mortgage? I'm really worried. I know this isn't the usual topic for your show, but thank you for your ideas. So, Danielle, this is really interesting, and I suspect Cheryl's situation is something that many people out there have some variation of, right? That worry about their parents as they get older, both their physical and mental state, but really the interaction of that and their financial state. Where would you start with a question like this?
So, when I'm tackling something like this and listening to this type of scenario, many people would first think about what the primary issue is. And that's just the first layer. The first layer is eventually they're going to run out of money if nothing changes. Their expenses are 100K per year. That's a lot for most people to consider. Like if you're just looking from a stereotypical way of looking at things in just a broad perspective, that's what most people are going to look at, is eventually they're going to run out of money. But from an expert point of view or someone who specializes in caregiving, I'm also thinking of, just because they have $100,000 worth of expenses, what are those expenses consisting of? Because that may be just from healthcare expenses. Taking care of someone with dementia can be very expensive, and getting proper treatment and caring for someone is very expensive. And so I don't want to just assume that that $100,000 is just spent on going vacations every year,
Right, right.
because because that probably isn't the case for these parents. And then if I'm unpeeling the layer, I'm thinking of, if eventually the father passes away, what is going to be left for the mother if there's, nothing left over? And dementia can last for a really long time. I think people, when they think about aging parents, and someone having the diagnosis of dementia, I think they just think like they'll just die very quickly. And that's usually not the case. Someone with dementia can need long term care for 8 years on average. So the father may live past the mother. There's a chance of that. The mother may be taking care of her husband, doing the caregiving duties, and her health may decline over the years. About 65% of family caregivers, just to drop some statistics, have a decline of health over their years of caregiving.
Okay.
So it might be, I just hypothetically thinking here, it might be that the mother passes away before the father. And then if I unpeel another layer, I'm thinking about if that really does happen, who is left to pick up the pieces? Is it going to be the daughter, you, that is going to pick up the pieces? Or is it going to be the government who's going to pick up the pieces? Who is going to pick up the pieces? Because someone's got to help.
Yeah. Yeah. Who's left to pick up the pieces? That's yet another just really important question. And obviously, we can never answer this question fully because we don't have every piece of information. But right, there's a bunch of, to me, interesting questions of, okay, where is the money coming from? They're in their 80s. Where has the money been coming from to cover this $100,000 a year lifestyle? Cheryl said something about they just ran out of cash, but it sounds like, I guess, they still have about a $750,000 net worth as I'm seeing it, right? So they have the 500K in home equity and $250,000 in stock portfolio. But nevertheless, at a burn rate of $100,000 a year, that's going to go away fairly quickly. So I guess just from a very concrete, I know this is almost beside the point, Danielle, but in terms of just covering their lifestyle, Cheryl asked reverse mortgage, selling the stocks, like what's your quick hit thought on just like the actual like brass tacks portion of it?
So if I'm thinking about if I'm not even thinking about the like expenses of $100,000 a year, I'm just thinking about asset allocation. If they're really burning through cash that quickly, having individual stocks is very risky. Like we're not looking at a 5 year or more time frame. We're looking at probably 2 to maybe 3 years maximum.
Right.
And that's very risky. So the first thing I would do, just if I'm just giving like basic financial advice, I would just be saying that I'd probably talk to a financial advisor and find a way to allocate that 250K from investments to somewhere else that's safer.
Yeah.
It's a really good time to put your money in high yield savings accounts because the interest rates are so high right now and has less risk involved.
Yeah, Danielle, that is a great point. So, okay, clearly when we talk about time horizons with individual stocks or even just mutual funds, we understand there's volatility over a short term period, but most of us have a 30, 40, 50-year investing time span. And we say we don't really care about the volatility, but clearly this is not the case for Cheryl's parents, obviously, right? So they have a couple of year time frame. So yeah, what would probably make sense, and of course, there are always factors, and I think it's important that we say the normal disclaimers that this is not financial advice. You are a CFP, I am a CPA, but we are not giving financial advice to anyone, and we're just having a conversation here how we would think through this. So I think hopefully our thought process of like how you and I chatting about this, because frankly, like this is on my mind too, long term care and my parents, my father specifically. So, this is a conversation that I wouldn't mind selfishly having. So we're doing it here on the podcast. But yeah, I mean, they have a couple year time horizon. So if this were me, this was my parents, I would say, hey guys, before there's some drop in the stock market or something, you probably want to think about maybe selling those stocks. And obviously, depending on what kind of unrealized gains they have, there might be separate issues, but I just would hate to see their $250,000 nest egg cut 20, 30, 40% because a stock happened to go down or the stock market in total. And like you said, with high yield savings accounts now at 5%, if you dumped $250,000 in a 5% interest bearing account, that's over $12,000 a year in interest, which is a not insignificant amount of their expenses. Obviously, like you said, Danielle, clearly, and we'll come back to that, like cutting expenses, that might be really the most important thing. But that's an interesting little strategy, which again then protects the downside and reduces volatility also. So I think there's really something there.
Yeah, I think the suggestions that we're coming up and we're collaborating on are unfortunately just the tip of the iceberg.
Yeah, this is maybe lipstick on a pig on the $100,000 expenses.
But when we're thinking about the reverse mortgage, I'm thinking about, who do you want to transfer the risk to? Do you want to transfer the risk to an institution, which is the reverse mortgage, or do you want to transfer that risk within the family? So, for example, this is kind of like an outlandish idea that many financial advisors don't bring up, but if there's a possibility for siblings to get together and pay for those monthly expenses, with the potential that they would inherit that house in the future, that may be a better route for some families than transferring the risk to the institution, with the fact that they may not be able to get as much money from the institution. Just because the house is worth $500,000 doesn't mean that the reverse mortgage is going to give them $500,000 worth. They're
Right.
retaining the risk. So your return is going to be more conservative.
Interesting. Okay. So reverse mortgages are something that we have not covered in 600 plus episodes of Choosify. Can you give like a 1 minute overview of like at the very high level, what is a reverse mortgage and what kind of like fees or expenses are you paying on it? So obviously it is based on your home equity, but why don't you jump off from there?
Yeah, so there's many different types of reverse mortgages, just like there's many types of life insurance. It's never just like one simple reverse mortgage anymore.
That would be too easy, right?
That would be too easy, right? But there's two main usually options. There's one where it's you're taking the equity of the home and you're turning into like a credit card, a credit line for yourself to use, and you can pull money when you please. The other one is just taking the home's equity, and then they are able to give you an annuity style payment each month.
Okay.
So there's also other costs associated with a reverse mortgage, just like you would when you sell a house. There's going to be some fees associated with the policy. My suggestion is, if that's the route you want to go, is to meet with a reverse mortgage specialist and see what policies they have available and have someone review it with you so that you know what your family's getting into.
Yeah.
Because at the end of the day, what's going to affect your parents is probably what's going to end up affecting you.
Yeah, no, that is a brilliant point. One other thing, and this might not be a palatable solution for most people because with aging parents, you probably don't want to upend their living situation, but is a conceivable option to sell the home, pocket the entire equity, and then let's say rent an apartment or rent a home at some point? When we just talked about, like, I'm just brainstorming off the top of my head of like, hey, we just talked about high yield savings account. If you could pocket $500,000 in equity, put it in a 5% interest bearing account, that's another $25,000 in interest income, which is not insignificant. That can cover a $2,000 a month apartment just from the interest. So, again, putting aside maybe the fact that that would be unpalatable for a lot of people to move, is that something that you've ever seen people advise in the range of options?
Yeah, as I said, it's like you can just look at the face value of this is the main option, but as you start unpeeling the onion, there's can be more than one option available to you. The only thing from a dementia like home care point of view is sometimes when dementia patients move locations, sometimes they have more difficulty, and on average they don't excel as well in other environments. Not saying that this parent would not. It just usually it's best to keep them in a home for as long as possible.
Yeah, no, that certainly makes sense. And yeah, that's right. I tried to go out of my way to put all the caveats of like, I'm not a heartless, crazy person here. I'm just saying, like, is this even conceivable? Because, right, they basically have $750,000 of net worth, which, yeah, right now doesn't provide them any cash flow or any accessibility. But is there a world where if you had that in 5%, you could get $37,000 plus of income? That's not nothing, so it's something to consider. But yeah, it just might not be viable based on life situation, obviously. So yeah, clearly we need to have a better understanding of their expenses. Like you said, if a significant portion of it is based on healthcare, then I mean clearly that's essential. Are there other areas of their spending that could be cut out? I mean, to spend $8,000+ a month when your mortgage is paid off. And if we assume, let's even put aside the healthcare, like it's hard to imagine that they're spending that much, like if it's not healthcare, but I imagine there is some fluff in the budget. And if this is going to come down to, hey, you are literally going to run out of money, that might be one of those uncomfortable conversations you want to have with your parents, right?
Just sit down at the table,
Yeah.
pull out all the bank statements and
Yeah.
figure out
Oh,
what's going on, which as a child, it's not an easy conversation. Like I've had that conversation with my parents because, we go back to, whatever is going to affect them is going to affect me. And that's not to be the person who's I'm a detective
right.
trying to figure out what their expenses are. But if they get to a point where they're spending a lot of expenses and can't afford to live that lifestyle, then it's beneficial to you to really figure out what's the root cause.
Yeah. How did you broach that conversation with your parents? Because that is uncomfortable. How did you approach that?
Um, I would say don't don't do what I did.
The cautionary tale. I like it.
And I'll tell you what I did. He more took it from a more I care about you point of view, but then I kind of twisted it to I'm fearful that if you don't take care of yourself, then I will not have any other options. Like I
Mm,
will have to cut you off because I don't know what I'm dealing with. I don't know what I'll have to deal with in the future. And I love my parents. I'm an only child. So obviously saying like I'm going to cut you off like was obviously a hard decision for me to make, but at that time I didn't really know what else to do.
yeah.
They weren't willing to have open money conversations, and I was fearful that if I didn't cut them off that I would be having to dip into my funds to take care of them.
Yeah. And that's incredibly uncomfortable, obviously, in every way. So, with the benefit of hindsight, you said, don't do what I did, but it sounds like it might have been like the shock therapy that actually helped in your situation. But, like, with the benefit of hindsight, what would you have done differently, or how would you advise somebody else to have that conversation?
I think I would get a third party to assist with it.
Oh, tell me more about that.
I think me being biased as a financial professional and also the emotional, having your parents and caring for them, sometimes you let your emotions get carried away through the conversation. Having someone who can be there as a third party, who's unbiased, who doesn't have those emotional ties, can make that conversation easier.
Yeah, no, that makes sense. Like, where would you even start to find that person to have that conversation with?
Yeah, so you can either ask a financial advisor, you could do a financial coach, you could do a financial therapist. The great thing nowadays is that there's more than one person you can reach out to for help.
Yeah,
And it can be maybe you're working with a financial advisor or even a third party friend that doesn't know really either of you too much. I really suggest going the professional route, but if you have no one else to turn to, you can use a friend or
yeah.
other family member.
Yeah, Danielle, I like that. I think it is important to have that third party. That's something that I just would not have thought of. I just that uncomfortable conversation. I would have thought that I would have to have it myself. But yeah, like just finding somebody you can trust. I think would be better probably in person, but maybe a lot of these financial coaches or planners you can even hire for an hour online. And, again, that probably might not work with aging parents, but you never know. So, okay, I have a bunch of questions that even though Cheryl didn't explicitly ask, about actual different care options, but I think that'll be better served for us talking about in the next question. So this came in from Joshua, and Joshua said, I'm 33 and I'm a nursing home and assisted living administrator. Residents I serve spend an average of $8,000 to $12,000 per month for some type of long term care. How do the FI models account for the last 3 to 8 years of an older adult's life needing to spend double or triple their regular expenses? How do I know if I get to a place for FI in my mid to late 40s that I will have enough when I'm in my mid to late 80s and still live the life I want without working 60 hours a week now and in the intervening years? So, yeah, Joshua, this is a heck of a question. Danielle, this is the perfect launching point for, I think, the all important conversation of long term care. I think a lot of us are coming at this from, okay, maybe our parents' generation are getting to need it. But I think Joshua's reframe of this of, hey, I'm in my 30s or 40s. How do I think about it for myself a couple decades from now? So I'd love it if you could just kind of run with this. I know you've put a lot of thought into it.
Yeah, I first want to applaud you for taking the initiative and asking these questions and understanding the importance of long term care. I would even say people in their 50s and 60s just brush off this topic like it's nothing.
Yep.
So, for a 33-year-old to understand the importance, I wish I could come there and give you an applause in person. Because this is what I've been trying to do. This is what I advocate for. So, thank you. So, if I'm starting to tackle your question, you've probably already seen what long term care looks like, or at least part of the long term care system. You're an administrator for assisted living facility. So, you've seen what your patients go through and what that looks like. But what does that look like for you? Branching off from your life experiences and memories, what do you want long term care to look like? I remember as a young kid, my first memory of my grandfather was him being in a wheelchair and not being able to actively participate in activities. My second memory of long term care was seeing my grandmother on hospice after a stroke and seeing what that looks like. And so I could go on and on. But trying to point those memories together and think of what those look like for you and for them and figure out what kind of care do you want.
Yeah, there's a lot of options. I think, yeah, Joshua is perfectly placed, like you said, having seen this in his real life. But for a lot of us, I think a lot of the different options that you just listed there, it's like an intellectual understanding, but not like a real visceral understanding. Like, and maybe frankly, not even an intellectual understanding. Like you hear these terms. Can you give like a high level overview of like what even are the different options? Like just again, super 30,000 foot view of it.
Yeah, it's amazing how much long term care is expanded and the choices that are available. There's in home care services. So, my grandmother had 24-hour care in her home. She was able to age in place, and that required working with care workers and care agencies. You have senior adult daycare. So, during the day, just like you take your child to daycare, you're taking your loved one to a senior daycare, adult daycare center, and they take care of them during the day. And then when you get off of work, you're able to provide care for them. So that's the main in home services. There's nursing facilities, there's assisted living facilities, there's memory care facilities. And then there's retirement communities that will adjust based on your treatment need. And that's a contract in place. So, depending on what your specific need is what you'll be able to receive. So, for example, someone who just, let's say, had a hip surgery and now they're going to an assisted living facility because they need extra care to complete the rehab needed to take care of themselves. The thing that most people don't understand is that they think that the government's just going to save them and Medicare is just going to take over and cover everything.
Yeah.
And I wish that was the case, but not so much. So Medicare only covers 100 days in assisted living facility.
Really? Okay.
And there's also some speculation as well. So example, if you're feeling better within those 100 days, they have a potential to kick you out because they're saying you don't need coverage anymore. So using government insurance, using Medicaid, Medicare, there are some risks that even though you're using those services and those services can be great, there also may be times where they may not feel like you need coverage.
Okay.
And that may inhibit your way of having care.
Gotcha. So, okay. So it sounds like, right, the government programs are not coming to the rescue for most people. So, I mean, does that mean that the vast majority of people who take part in any of those long term care choices that you listed, in home care, senior adult daycare, nursing, assisted living, memory, are paying for this out of their own pocket? I mean, is it truly as simple as that?
Yeah, most are. If you don't have long term care insurance, it's likely that you're paying it out of pocket.
Okay. Interesting. Now, I'm not expecting you to have these facts memorized by any means, but like, do you have just a general sense of how long people stay, let's say in one of those, the nursing facilities or assisted living, on average, how many months or years they stay, and like even just a rough cost, just to give people like who have no idea, like, are we talking $500 a month, 5,000, 10,000 more? Like just some rough back of the envelope.
Yeah, as what was stated before, is assisted living facilities, nursing homes are very expensive right now. And depending on which state you live in, they might be even more expensive. For example, California versus Texas, Texas is going to be one of the lower end states for care.
For cost of care.
For cost of care, yes.
Gotcha.
So if you're one of those people who are thinking, I'm just going to move to Thailand, it's much cheaper
Yeah.
for long term care, go you. But most people, that's not going to be the case. They're going to have to find a way to cover the cost of care in the United States, which usually can roughly range from in cost per month, anywhere from 8 to 12, as was stated for assisted living facilities. And if you're looking for in-home care, you can range from 16 to 20,000 per month, depending on how many hours are needed for in-home care.
Wow. Okay. So in-home care is actually more expensive than a full year-round 24-hour day facility, right? On average.
On average. But if you're, for example, let's say you're only doing 10 hours per day, you're just having someone cover you for the 10 hours, it might be cheaper than assisted living. So that's when you kind of have to weigh the pros and cons of what do you want your comfortability to look like and how much money can you afford to pay for these costs.
Right. And like you said, aging in place was the term you used, which is yeah, I mean there's obviously a lot of value to that, but clearly there might become a point where that's not an option for some people depending on the type of care and the level of care they need. Okay, so this is clearly a extraordinary amount of money. So this is one of the most important factors that we need to be considering for our financial lives. I mean, not to ask a really uninformed question, but we have an aging population. I mean, tens of millions of people of this age. And you always hear, again, as a financial podcast, like most people can't cover a $400 expense. How on earth are millions upon millions of people who need this type of service covering 8, 10, $15,000 a month for care when I think most people actually do think the government is going to ride to the rescue on some level, but you're here to say that's not the case. Like, how are people doing this?
At least it's not the case right now.
Right.
I can't say for the future,
Yeah, we don't prognosticate what's going on.
but most people are just dipping into their savings.
Okay.
If they're not having a product like long-term care insurance, they're finding some other way to supplement it. The way I think about paying for long-term care is kind of like picking out ice cream. You have many different types of flavors. We'll just go with the basic ones. We'll think of chocolate, vanilla, and strawberry. So, chocolate is self-funding. Let's say vanilla is products, annuities, long-term care insurance, and then you got the strawberry, which is government funding, which is Medicaid. Depending on the state, will have different requirements. But you may have a beautiful long-term care insurance policy, but you may need to double up on that scoop of ice cream. The long-term care insurance policy may not cover it all. It may just cover 80%. So you may need a scoop of chocolate, such as like dividends. You may need rental income or other sources of income to supplement that long term care insurance. So, what I'm telling most people and clients is that even though we may think that the basic flavors of chocolate, vanilla, and strawberry is going to be enough for us to survive in long term care, having multiple sources of income that you can use to pay for these cost of care is essential.
Yeah. Okay. This is super interesting. And right, I wonder in some of our financial independence modeling softwares if you can essentially game out like, okay, what's my FI number if it's based on my current expenses, but if I game out, hey, it might cost $200,000 a year for my care facility from and again, you can never know, but you could pick X number of years. Like that might impact your FI number because that's yet another way to do this is to, like you said, essentially you're self-funding it, but self-funding it through a FI calculation.
It goes back to what we talked about before. Are you the one who's taking on the risk or is somebody else taking on the risk? Because for many people, especially if you're starting to save already at 33, I commend you and maybe you might be able to self-fund based on how much you're saving for your FI number. But if you're someone who's in their 40s, 50s or later and trying to save, you might have a much harder time self-funding than others.
Yeah, no, that makes sense. So, okay, you've mentioned long-term care insurance a handful of times, and you also said something about other products and annuities. I want to hear a little bit about all of them, but very specifically long-term care insurance. I think some people hear just in the ether, like, "Oh, long-term care insurance, it's a gimmick. They're never going to pay out." Like, I've heard these horror stories, and frankly, I'm in the age range where I'm like, "Oh, okay." Joshua was thinking about this in his early 30s. I'm 44 at this point, Danielle. I think it's probably time that I start understanding, is this something real? Is this something that's worthwhile to start thinking about now? Or, am I a little too late, frankly, but is now a good time to start thinking about it? So, can you give me an overview of long term care insurance from your perspective?
Yeah, I have a love-hate relationship with long-term care insurance. Full disclosure, I don't sell any insurance or investment products. I love it in the way that it's provided my family comfort. My grandmother had an old policy, a Genworth policy back from the 90s, and so it was when I felt like long-term care insurance was kind of fairly priced. Now it's very expensive, but I loved the ability to not have to worry about paying for long term care. That definitely brought comfort to our family, knowing that it was fully covered. The $20,000 worth of expenses per month was about 70% covered. So I felt comfort and insurance knowing that. Do I think that it's best for everybody? No. There's a lot of different policies now. It's not just the strict, I pay into it monthly and I get some benefit down the road. My suggestion, if I'm you, is to research all your options, get your FI number and figure out how much it's going to cost for care, figure out what kind of care you want, and then from there, you can research different options. Look into policies. Don't be afraid to just call up an insurance specialist, a long term care insurance specialist, and just say, I want to learn about policies. Educate me about these policies, how they would help me, and then I can review it and decide from there. I know insurance agents are looked at as a sales position, but if you can find someone who truly has your best intentions and can educate you rather than sell you, then you can really decide what options are best for you. Because now is the time, whether I'm assuming you're healthy,
Yep.
now is the time to at least research options and see what's best for you. At least have everything on the table so you can say, oh, this one seems bad, this one seems good, and you can decide for yourself what's best for you.
Gotcha. So, is a long-term care insurance policy, is it something akin to a term life insurance policy where you have this policy if you choose to keep paying on it each year and it stays in place for like a contractually obligated amount of time? So basically, I'm thinking like, can the insurance company just say when you're 70, like, hey, we're not, this policy's done and you've been paying in all of these years? Like, is that something to be concerned about? Or is this something that stays in force for X number of years?
If I'm understanding what you're saying, sometimes there's speculation regarding filing a claim within the insurance policy. Sometimes not everybody is able to receive and get the coverage based on their health. It really depends on what we call ADLs, which is assisted living activities. If you meet two of the six, at least, then you're covered. But for some people, if they're not filing the claim process, they may not get the coverage needed. For example, it's not just like money just comes into your lap. I wish that was like, okay, I can't feed myself, I can't bathe myself, which is two of the ADLs that I can just automatically just get money. That's not how it works. Just like disability policies, for example, there's a period of time where they want to make sure you actually need care. And that's usually called the elimination or waiting period. That can be up to 90 days. So for my grandmother, she had to wait 90 days to receive benefits. Then she had to go through an assessment. So we had a nice sit down conversation. I told her, you're not doing well. Just because it's a stranger, don't act better. Like, don't sugarcoat things
Right.
because you're really in a wheelchair. You are really sick. You cannot take care of yourself. And so we had that conversation of what the assessment would look like so that she's not sugarcoating just because it's a stranger. Like she can just walk miracles or something like that. And then you file all the paperwork. Sometimes they ask for doctor's letters and they review the claim And then the long-term care insurance policy, the company decides whether or not to accept you or not.
Gotcha. Okay, that makes sense. And then going back to somebody getting this policy in their 30s or 40s, what's the benefit of having this policy in place when there's a extremely high probability that you're not going to need it for 30 or 40 years? Is it just literally that you won't be able to get a policy of this type in your 60s and 70s and beyond? Is it dramatically less expensive per month if you're paying this for in your 30s, 40s, 50s, but you're locking yourself in? Like, how would someone think about, like, when is even a good time to get this? Am I just wasting money, or am I shutting myself out of it in the future? Like, I think that's like the real heart of this, like that people just don't have any sense of where to start with that.
Yeah, I think it's scary as a young person because you don't want to assume you're not going to need long term care, but you're not able to tangibly see what that benefit is, or you may not even ever be able to see. Maybe you just get hit by a car and automatically die, and you never need the long term care insurance policy. And that's the risk you're taking when you're filing the policy is one, I'm not able to see the tangible benefits right away. It's not like the stock market where I can see it go
Right.
up and down every day. And then the second is majority of people, 7 out of 10 people need it, but you may just be the 3 out of 10 who don't need it. And that's why a lot of people are instead looking at life insurance policies with a long-term care rider. But you have to make sure that that long-term care rider actually covers enough. So at least you're getting the tangible benefits of the life insurance policy if you die, and you still have the long-term care policy available to you.
Okay. So that's a hybrid option. So now I'm assuming that's not just a simple term life insurance policy. So that's going to be something like a much more expensive type of, I don't even know if it's whole life or whatever it would be, but that's something else to consider. But right, like you're saying, it could be both of those, long-term care and traditional life insurance as well.
Yeah, that's why it's so important to really meet up with someone who specializes in insurance policies so that they're able to educate you about what your options are and really lay it on the table for you. Because if you don't know what your tangible benefits are, it's really hard to pay into something like that.
Yeah.
One other thing I wanted to talk about is who's going to help be your support system when you need care. For many, that's going to end up being your children. But for some who don't have children or other support systems around you, you may need someone to help you out. You want someone to be there and be your advocate for you, not only to be your friend, but to be that person who holds you accountable. And this may decrease the amount of expenses that you have during long term care because you have that support system available to you. Like, for example, if you do adult daycare during the day, which is a lot less expensive than assisted living facilities, and have someone take care of you during the night, then you can kind of substitute cost. But you have to ensure that the person's going to be willing to take care of you during the nighttime. So it's finding that support system. When we talk about aging in place, I think about it's not a long term care solution. It's a way of living, it's a way of wanting your life to look like. And creating an age in place solution would be creating an environment around yourself that can take care of you. Who's going to be able to pick up those newspapers in the front of your doorstep when they come? Who's going to be walking your dog when you can't? Who's going to be giving you the meals when you just had surgery and can't make your own meals? Having your support system is crucial for getting through long term care as well as helping you reduce your expenses.
Yeah, Danielle, that is such an important thing. And I think that's probably the perfect way to end the episode here. I suspect strongly this is part one, and I would love for you to come back. I think the audience is going to have a lot of questions and a lot of very specific, targeted questions. So, for you out there in our community, if this is something that's important to you, send me an email, feedback@chooseify.com, or really the easiest way is get on my newsletter, chooseify.com/subscribe, and then just hit reply to any of the emails that I send every Tuesday, and send in very specific questions that you'd like us to do in a round two. I think this is so important. It's long overdue. And yeah, Danielle, thank you so much for being here.
Yeah, I had a lot of fun. Thank you. I'm happy to answer any questions in the future.
That's wonderful. Danielle, I mentioned earlier that you're the founder of Spark Financials and you're a CFP, but how can people get in touch with you?
If you just like to pop in and see what I'm doing on social media, you can. I usually focus on Twitter and LinkedIn. Feel free to DM me if you're also going through caregiving or worried about long term care. I'm happy to support you.
Nice. And we will have those links in the show notes. And yeah, until next time, Danielle, thank you again. And thanks for being here.
Thank you.